So this is a big, seems to be big case, and you can understand now. 11-year-old girl, again, actually sphingolipidosis is present more commonly in Ashkenazi Jewish origin people. So Ashkenazi Jewish descent is brought to hospital for severe pain in knee, right knee, when standing. Her parents reported that she has always, see the age also, 11 years, she is a child. Now, diffuse pain in her bone, so bone pain, for which she has a negative workup for pediatrician. So she actually, her parents report that she has always had diffuse pain, for which she had a negative workup by pediatrician. The pain has progressively, so pediatrician did not find any actually conclusive diagnosis for this pain. Okay, and that is what this statement says. Now pain has progressively worsened in last week. So pain has progressively worsened last week to the point that she now refuses to stand on her right leg. On examination, she has decreased range of motion in right knee to both active and passive forces. Even when you try to stretch, it's difficult to, the range of motion is not that good. No signs of ligament or tendon damage. So injury is not there. Even without injury also, there is no range of movement. She complained of significant pain during testing. During that testing also, this is flexibility testing, so of this knee, she had pain. She has hepatomegaly is also noted, but her examination is otherwise within normal limits. X-ray of joint is consistent with avascular necrosis of femur. Femur has avascular necrosis. Marked osteopenia is there. A complete blood count shows a normal white blood cell count. Normal white blood cell count with normal differential and normal hemoglobin. However, the platelet count is decreased. So this is related to petechiae. So platelet is related to petechiae. What is petechiae? Actually, extravascular bleeding deposited under mucous membrane. This is petechiae, small dot under mucous membrane and below skin. This is petechiae. So this platelet is decreased, bone pain is there. So which disorder is this?
Gaucher.
Yes, simple. See, you remember this, you understood. The bone related disorder, Gaucher disease, hepatosplenomegaly. Yes, bone marrow failure. But here you did not find marrow failure, but marrow failure is expressed in terms of platelet count, low platelet count. Pancytopenia, all cells, RBC, WBC, all are decreased. Osteoporosis, osteopenia we have seen. Avascular necrosis of femur we have seen. Bone crisis, pain in bone is bone crisis. So these all features you can see here in this patient, in this girl, 11-year-old girl. You can see everything. So this actually age of onset is childhood. So the patient, you will not find this Gaucher disease in newborn baby. So it is more in children. You can see what is the possible diagnosis. Okay, you have the previous two disorder in infant, and this disorder, this next two disorder will be in children. So what is your diagnosis? Gaucher disease. So what is the enzyme deficiency? The enzyme also starts from G, because glucocerebrosidase. Glucose is present in extraneuronal tissue. That is why you can see extraneuronal manifestation here. Glucocerebrosidase. What lipid is deposited? Again, G. Glucocerebroside, or it is also called glucosylceramide. So this is the disorder. You can see this. So these are the presentation you can see. These are the patient you can see. patient is children or adult. Now, here the presentation is bone related. Marrow failure, bone marrow failure, bone marrow failure, hepatosplenomegaly, okay, and then chronic bone pain. These are the presentation, okay. And then joint mobility also has problem because of avascular necrosis. You can see this also cause problem in joint mobility. So the spleen will be affected, and then your liver will be affected, bone marrow will be affected, other organs as well will be affected. The macrophage will be laden with this glucocerebrocyte. Macrophage will be laden with glucocerebrocyte, and this macrophage will appear like this. Very beautiful picture. So this is called wrinkled paper or tissue paper macrophage. Gaucher disease. I how do I remember? I'll tell you. I remember this bone for this Gaucher disease, and bone is wrapped with tissue paper. So this is how I remember. So this is related to bone and wrapped with tissue paper. And this picture. So this person, you can imagine also this person, that cloth is tissue paper. Cloth is made up of tissue paper. So you can remember both. So tissue paper macrophage in Gaucher disease. Okay, the enzyme is glucocerebrosidase, beta glucocerebrosidase. There is only one glucocerebrosidase type of enzyme. That is why beta glucocerebrosidase. Just remember glucocerebrosidase, because there is no alpha glucocerebrosidase. Always beta glucocerebrosidase is there. So you will not be confused in this. And glycosyl ceramide or glucocerebrosidase will be laden in this. So this is the tissue paper, wrinkled paper or tissue paper macrophage you will see in Gaucher disease. Gaucher disease, see. So Gaucher disease made me like ghost. This is just cartoon to enhance your memory. Abdominal enlargement, bone dysmorphosis, marrow failure, you can call it. You can add the point, restricted joint mobility, and you can add here, I have wearing a cloth of tissue paper. So that is how you can remember this. So Gaucher disease will act, this is glucocerebrocyte or glucosyl ceramide, and this enzyme will act here. It breaks this bond. If this enzyme is not there, this bond will not be broken, and this will be accumulated in macrophage, and macrophage will become a tissue paper like appearance or wrinkled paper appearance.